Hello, and welcome to today's webinar entitled When We Grieve, Navigating Loss, Finding Support, and Healing. My name is Catherine Marone, and I am the Social Work Director here at the World Trade Center program at Mount Sinai. We acknowledge that the topic we are discussing today is deeply personal and often painful. Members of our program have needed to navigate through grief and loss in many domains of life. This webinar will focus on the emotional and practical challenges of grief and loss experienced by 9/11 responders. Participants will gain insight into the grieving process and learn about supportive resources available to aid in healing. We invite you to be gentle with yourselves and engage in a way that feels most comfortable for you. It is my pleasure to introduce our speaker for today. Massielle Morales-Miller is a licensed clinical social worker and social work program manager at the World Trade Center Health Program here at Mount Sinai. She is trained in meaning-centered psychotherapy for terminal and chronic illness, prolonged grief disorder treatment, and several evidence-based trauma therapies. Massielle has extensive experience with providing grief-informed care and supporting clinicians in this work. Her current focus centers on bereavement, loss, and trauma. She's deeply committed to culturally responsive care and strives to normalize the diverse ways people experience and express grief. Once again, thank you for joining us today, and I hope everyone will enjoy this presentation. There will be time at the end for Q&A, so when the time comes, you can type your questions directly into the Q&A area of the Zoom. I am happy now to turn things over to Massielle.
Thank you, Catherine, and good afternoon, everyone. It's an absolute pleasure to be with you all today as we navigate the difficult topic of grief and loss and the hopefulness of support and healing. I would like to start by sharing a brief poem that I believe reflects how some of us experience grief. I sat with my anger long enough until she told me her real name was grief. It can be challenging to fully comprehend our grieving process, especially given the despair that often accompanies it. We may want to express our grief as anger. We may withdraw or isolate ourselves and even experience guilt or regret. The collective trauma of 9/11, followed by war and a pandemic, has significantly impacted our lives. My hope for this presentation is that everyone leaves with a deeper understanding of grief and loss, develops compassion for themselves and others experiencing grief or loss, allows for the difficult process of grieving, and that you feel empowered to seek help and support whenever you need it. Now that we have spent a few moments grounding ourselves in why this conversation matters, let's take a look at what we will be covering today. We will be discussing key terms, which will provide us with a shared language, relevance to this community by briefly touching on certification data, exploring the heart of our topic by discussing what we know about grief and what it looks like, and then move into support services, highlighting resources available. And before we close, we will take a short mindfulness break to allow for a moment of breath, pause, and reflection. We will also have some time to cover questions. You may be wondering, if grief looks so different for everyone, how do we even talk about it? Before we go deeper, it's helpful to ground ourselves in a shared language. So let's just take a moment to review some key terms that will help us understand the different forms and experiences of grief that we might encounter. Grief is how we emotionally process think about, and adapt to significant loss, whether recent loss or loss we anticipate in the future due to death or other causes. Bereavement refers to the loss of a person significant to us, while mourning is how we express our grief through various rituals or behaviors. Anticipatory grief is experienced before a death, occurring when we foresee the eventual death of a loved one. And this is most common in chronic illness or end of life situations. Illness related grief is the grief associated with the loss of function, vitality, roles, and activities in the context of progressive illness or natural aging. Understanding the scope of loss helps us approach grief with more compassion and clarity. I would like to share a de identified example of a patient in treatment. Mr. C, a middle aged retired sanitation worker, was engaged in trauma focused treatment with me for his PTSD. During our sessions, he learned that a colleague, also a 9/11 responder, had been diagnosed with stage 4 cancer. This news led to a resurgence of his symptoms, including difficulty sleeping, increased irritability, and persistent intrusive thoughts and worries about his own response work and its potential implications for his future. We will revisit Mr. C's case later in the presentation, but for now, I want to shift our focus briefly to the relevant statistics. So let's take a look at these numbers, not just as data, but as a reflection of the ongoing human toll and the resilience of this community. When we think about grief related to the September 11th attacks, we remember the many lives that were lost during an unprecedented traumatic event, one that reshaped families, communities, and the sense of safety for countless people. It's important to recognize that the losses didn't end that day. The impact continues. And over the years, we've seen high rates of serious health conditions among responders and survivors. For responders specifically, more than 23,000 cancer certifications, over 11,000 for PTSD, nearly 3,000 for major depression, and around 4,000 for COPD. These numbers tell a story of ongoing loss of health, stability, and even identity for those who have spent years living with the consequence of that day. Furthermore, as many of us will inevitably experience, retirement often brings unexpected losses that require significant emotional processing. We've talked about my treatment patient, Mr. C, but there are many responders I have treated that are not only processing the direct effects of their 9/11 response work, but also the profound aftermath, such as chronic illness and cancer. These conditions significantly impact daily functioning and quality of life. Patients often grieve not only the loss of colleagues, but also the loss of their own physical and cognitive abilities. With that, we begin to understand why anticipatory grief and illness related grief are very real. People are grieving not only for lives already lost, but also for the fear of what may come, the uncertainty tied to illness, and the constant reminders of vulnerability. Every anniversary of the attack can stir memories, reactions, thoughts, and behaviors that may feel confusing or unexpected. It's common for old emotions to resurface. So we ask ourselves, what is normal grief? How do we know if what we're experiencing, the sadness, irritability, guilt, or even numbness, makes sense? And when does grief cross into something that needs more support? These are the questions we will explore together, because understanding the many forms of grief helps us better care for ourselves. When you hear the word grief, what words, feelings or images come to mind? I invite you to please use the Q&A function to share any thoughts that you have around this. I see laying in bed, sadness, an empty room, funerals, pain and longing, overwhelming feelings of sadness, memorials. Thank you. Oh, memories. Thank you all for sharing. Here, we see someone holding his head in his hands, capturing a moment of visible emotional distress. We see words describing this complex experience and the different aspects of grief, some of which actually came up in the Q&A. Sadness, despair, pain, anguish, heartache, mourning, letdown. I want to acknowledge that this is what we often think about when we think about grief and loss. But for some, it may also bring up anger and guilt or relief and confusion. Some images were an empty room, and other images that may come up include specific rituals or even quiet moments alone. Grief is deeply personal. It's shaped by our experiences, our culture, our relationships, and the kind of loss we ourselves have faced. There's no single or right way to grieve, and there's no right timeline to follow. This question simply helps us recognize that grief is more than a feeling. It's a full life experience that can touch every part of who we are. I mentioned that grief is deeply personal and that there's no single or right way to grieve or a right time to follow. And I want to emphasize this. I want to emphasize the personal and cultural context to grief expression. Grief expression manifests in many forms, and it doesn't always look like what we might expect. Sometimes it's loud and visible, other times it's silent. Some individuals may appear joyful, while others might wail or remain stoic. Some may appear unwashed or show emotion openly. It's even common for some to report seeing or hearing the deceased. These are all expressions that are part of the grieving process and do not necessarily indicate a need for formal assistance. Grief means something a little different to each of us. Yet, there are some shared components that do help us understand how people process loss. Let's review these core components of grief, as well as two widely used grief theories that help us make sense of what this experience may look like over time. Grief can present with symptoms that are very similar to depression, and it shows itself as a very complex process with psychological, physical, cognitive, social, and spiritual dimensions. Physically, individuals may experience pain, fatigue, insomnia, or changes in appetite. Cognitively, we see an impact on memory or attention. Socially, it can lead to feelings of disconnection from others and from work. Grief can also profoundly impact one's belief system and our sense of identity. An acute grief process, which is referring to a high intensity grief, typically lasts about a year post loss. But if symptoms persist beyond that year mark, it can be time to consider more formal help and support. While the grief process is experienced universally, there are ongoing concerns about the medicalization of grief. This belief that grief is problematic and always requires intervention, because that's just not the case. Just the act of being means we experience grief and loss, both physically and non physically, at different points in our lives. Let's take a look at how experts have tried to make sense of these experiences. This brings us to grief theory, which helps explain how people adapt, cope, and find meaning after loss. We're going to start with the Kubler-Ross grief cycle and its applications to understanding grief. This is a very well-known theory that outlines the stages of grief. And while initially conceived as a linear process, it has evolved to recognize that individuals can experience these stages non-linearly, moving between denial, bargaining, anger, and depression. These models also suggest helpful interventions for each stage, such as providing information during denial, offering emotional support during anger, or giving guidance during acceptance. In acute grief, we typically observe a nonlinear progression through these stages, eventually leading to acceptance. It's important to note that not every stage is experienced by everyone. The goal is for individuals to gradually integrate their loss in an adaptive way, accept its reality, and regain a sense of well being. In cases of complicated or prolonged grief, that acceptance or integration of loss may not occur. I find this framework particularly valuable because it acknowledges the complex emotions that are involved in grief and provides guidance for appropriate formal and informal support. It also reminds us that while we may want to offer advice to those struggling with grief, they may not always be ready to receive it. Let's revisit the case of Mr. C, who I mentioned earlier in the presentation. During our work together, he responded very positively to trauma-informed care that focused on his experiences with 9/11, while also allowing space to address other aspects of his life that influenced his thoughts and his emotions and his behaviors. We observed significant improvements, including better sleep, increased socialization, enhanced relationships, and a decrease in the avoidance of distressing thoughts. All very positive outcomes that we aim for in treatment. As I also noted today, simply existing means we inevitably encounter grief and loss, both physical and non physical, throughout our lives. The news regarding his colleague was particularly distressing for him, which is understandable given our natural concern for those within our circle. For him, this event, the news of his friend, reignited his worries related to his response work, bringing back what if questions that escalated the anxiety. If we were to place him within that Kubler-Ross grief cycle, he wasn't avoidant. He wasn't in that stage because he brought it directly to our session. But I did need to work with him in identifying where he was in that process. Was he in a stage of anger? Possible, due to the heightened worries. Was he in the bargaining stage as he tried to make sense of what was happening or struggling to find meaning? Perhaps both. Our work temporarily shifted to provide him with the space to process this information, feel comfortable expressing whatever it was that he was feeling and thinking without judgment, and ultimately allow me the opportunity to extend the support that was necessary in that moment. As we think about his case, it will also help us to look at one other model that captures the ebb and flow of grief. And I find that the dual process model of grieving is incredibly helpful for understanding and conceptualizing that ebb and flow. It was developed in 1999, and it initially focused on the loss of a partner, but is now widely used for the loss of any close person. It identifies two types of coping processes, the loss-oriented coping and restoration-oriented coping processes. And it normalizes the idea that one can simultaneously grieve and attend to daily life. Loss-oriented coping involves the direct confrontation or concentration on the loss itself. It often focuses on the relationship with your lost loved one. It encompasses traditional grief responses like yearning, looking at photos, crying. And while it can bring painful longing, it can also evoke pleasant reminders. The model suggests that there's no fixed sequence. Though people often experience more loss orientation earlier on in bereavement or recently after a loss, gradually we begin to see a shift in attention to other things over time. Restoration oriented coping refers to that secondary source of stress that arises from the practical adjustments that are needed after a loss. It focuses on how new challenges are addressed rather than just the outcome. For example, a person might need to take on a task that was previously handled by the deceased, such as managing their finances or cooking. And it also includes reorganization of one's life and even forming a new identity. For example, transitioning from spouse to widowed. While these tasks can bring anxiety and fear, the mastering of those skills can also lead to feelings of relief and pride. So let's revisit Mr. C's case for one moment. Although he was presenting with worries and anxiety and these what if questions, he also demonstrated significant resilience, or what we call healthy oscillation, this movement back and forth. He reached out to his colleague who was diagnosed with stage 4 cancer to offer support and continued plans to visit his children and young grandchild, even as he questioned all these what ifs. That oscillation between the loss oriented coping and restoration oriented coping sometimes occurred within one single session. At other times, session focused on his role as a grandfather or even his retirement plans. Because while retirement represents a significant loss of a previous life stage, it also presents enhancements in other aspects of life, particularly for Mr. C concerning his children and grandchild. This is the restoration oriented coping. We also spend time addressing, really sitting in that anticipatory grief, during which he explored concerns about his future, health, and other existential questions. This was that loss oriented coping. That response, that back and forth, that is a normal presentation in grief. In this case, anticipatory grief, especially given the recent news of his colleague's health. So, going back to that dual process model, a key strength is the normalization of that constant nonlinear back and forth between confronting and avoiding different aspects of grief. That oscillation is crucial for long term adjustment. And individuals may need distraction. They might find certain aspects that are too painful to confront in any given moment, or they may attend to new responsibilities. As long as that distraction or denial is not extreme, it's a necessary part of the grieving process. In acute grief, that healthy oscillation, that back and forth between loss oriented and restoration oriented coping is expected. And that will eventually lead to a reduced need to dwell on certain aspects of the loss. In contrast, in complicated or prolonged grief, what we see is a lack of that back and forth, with individuals remaining stuck in that loss oriented experience, such as extreme rumination or denial. This model is particularly valuable because it considers not only the emotional impact of loss, but also the practical daily stressors and needs that we have to manage as a direct or indirect result of our grief. So now that we have discussed grief, how it can present, and its relevant theories, I invite you to share your personal experiences with grief, both in yourselves and in others. How has your understanding of grief changed, if at all? Has it impacted your view of your experience or of those that you support? And what has surprised you the most about the diverse ways in which grief can manifest? Please share your thoughts and reflections in the Q&A, and I'll give this just a moment. Okay, I see that it's helped me understand grief better. It's helped me realize that what we may think is helpful in one moment may not be as helpful as we thought, that it looks different for everyone, that there are so many different ways to process grief. Yeah. There's an absence that can't be filled, and accepting this changes over time. Absolutely. Absolutely. That it's a reminder to connect with others for support. Yes. Being able to hold space for others. Someone even sees a close loved one's anger differently. Thank you all so much for taking the time to share. While grief naturally involves extremely difficult emotions, it's important to recognize when these feelings become impairing. Grief is not something that we just get over. It's something that we learn to live with. Research tells us that positive social support, which I think was actually just mentioned, significantly improves bereavement outcomes, particularly for the small subset of individuals that may experience complicated or prolonged grief. This is why seeking support is crucial when grief symptoms begin to interfere with daily life. Some of these impairing symptoms can include feelings of disconnection, being unable to stop reliving the death, or completely avoiding the loss. Experiencing significant physical symptoms such as panic attacks, sleep disturbances, issues interpersonally, rapid weight gain or loss, thoughts that life isn't worth living, or more critically, thoughts of self-harm, which requires immediate assistance. Becoming socially withdrawn to the point where others express concern, substance misuse, or feeling what we can refer to as stuck in the grief process even after several months have passed. If you or someone you know is experiencing these symptoms, please consider reaching out for support. When it comes to coping with grief, support exists along a spectrum. For many people, informal supports play a big role in healing. Family, friends, faith, or community groups often create space for connection, remembrance, and meaning making. These can be very powerful sources of resilience, reminding us that we're not alone in our loss. And then there are more formal supports, which can be very helpful when grief feels overwhelming or prolonged. These include peer and support groups, mental health professionals, or palliative or hospice care teams, all of who are trained to help individuals and even families navigate that emotional, physical, and even existential dimensions of loss. There are also evidence-based grief treatments, such as prolonged grief therapy and meaning-centered grief psychotherapy, as well as cognitive and mindfulness-based approaches that help people process loss, rebuild routines, and reconnect to purpose or meaning. It's important to remember that not everyone needs formal support or treatment. And in fact, most people are able to integrate this loss naturally and over time. They learn to live in a world that is absolutely changed by absence or reduced ability and chronic illness. But healing doesn't mean that we've forgotten. It simply means that we're finding a way to move forward while carrying the memory and the meaning of what's been lost. Grief is a deeply personal experience, and healing often begins within a community. Formal care is also available when that weight of that loss feels too heavy to carry alone. Our program offers mental health services to eligible responders and social work case management services to help connect responders to both informal and formal supports. Additionally, there are various hospitals in New York City that offer bereavement support for different types of losses. We encourage you to contact us, regardless of whether you believe your grief or mourning is directly related to 9/11. Our clinic offers grief-informed treatment to eligible responders in all outpatient capacities, including individual treatment, group treatment, and medication management. Over 20 years, almost 25 years after the 9/11 attacks, we continue to evaluate, certify, and treat responders that are just now reaching out and seeking support. We're here for you, so please do not hesitate to reach out. Grief is a heavy burden, and we're here to help lighten that load. So call us at 212-241-8462, and one of our social workers will connect with you, and then connect you to additional resources and absolutely provide you with an overview of the next steps. For those in emotional distress, in crisis, please call 911, or you can call and text 988, which is the Suicide and Crisis Lifeline, available 24/7 with immediate confidential help. For ongoing grief support, I have included grief support websites on this slide, but reaching out for help is a sign of strength, whether it's in moments of crisis or simply when the weight of the loss is heavier than usual. And 988 is an amazing resource, but again, if you require more immediate assistance, please call 911 or go to the nearest emergency room. We've discussed some topics today that might have brought up intense or uncomfortable emotions. And I'd like to conclude our session with a mindfulness break to help us pause and become aware of our current experience, including our bodily sensations and breath. So I invite all of you to close your eyes or keep them open if that feels more comfortable. Ensure your feet are flat on the floor or grounded in some way, and that you're seated in a comfortable position. Begin by asking yourself, how am I doing right now? Bring your attention to your inner perceptions. Start to notice any thoughts, feelings, and physical sensations that you're experiencing. Try to translate that experience into words. For example, these are self-critical thoughts. I notice I am tense. I notice I am relaxed. Pay attention to those sensations in your body and allow yourself to fully feel what is present in this moment, and then accept it. And remind yourself that whatever you are feeling is okay, and it's perfectly fine just as it is. Now, gently shift your full attention to your breath and start to follow the natural rhythm of your breathing. Breathing in deeply for a count of 1, 2, 3, 4, and holding for a count of 1, 2, 3, 4, and then breathing out for a count of 1, 2, 3, 4. Continue to breathe and allow your attention to expand to the rest of your body. Feel how your breath moves throughout your entire body. With each in-breath, notice your body gently expanding. And with each out-breath, feel it shrinking. And continue to breathe in this manner for another 30 seconds, breathing in deeply for 1, 2, 3, 4, holding for 1, 2, 3, 4, and breathing out for 1, 2, 3, 4. I invite you to continue to breathe. And when you're ready to come back, you can slowly open your eyes and take one final deep breath as we transition to questions and reflections. Thank you all for taking the time to reflect on grief and healing together. Grief is a deeply human experience. It's complex, it's individual, and it's ongoing. And my hope is that today's presentation has offered the language, perspective, and compassion for what so many continue to carry. I'd like to open the space now for any questions, reflections, or any thoughts that you'd like to share today. And as I allow those to come in, I want to remind you all that in another 2 weeks, we will be hosting a sleep webinar for those that are interested. And we will be dropping information about that in the chat shortly. Oh, it's already there. All right. I have a thank you. You're very welcome. Thank you for being here today. Yeah. I got another comment that says that sometimes it feels that discussing grief or loss is taboo or shouldn't be discussed. It is. It's a difficult topic, but definitely not a taboo topic. We all experience some type of grief or loss at various points of our lives. It helps to normalize the process. Good. I'm glad. You're welcome again. Okay. I have a question on someone says that they come to monitoring every year but have never participated in mental health services. They have recently also lost a loved one this year and they're having a hard time. They're wondering if we can help. First of all, I am so sorry for your loss. And I also want to encourage you to reach out to us at 212-241-8462 to speak to one of our social workers, and they will absolutely help connect you to the appropriate resource depending on your individual circumstance. My best friend was just diagnosed with cancer related to WTC. I'm so sad. Of course, this speaks to anticipatory grief. It also speaks to the type of grief and loss that your friend is experiencing, but it's absolutely normal to feel sad when you find out that someone in your close circle is not doing well. And I think that hopefully today's presentation helped us understand that community supports are vital during these moments, but that we have to also be very attuned to what that other person may need in any given moment. And I'm also very sorry that your friend was just diagnosed with cancer. This is unfortunately something that continues to happen. And I have one last question here. I've been sick with a lot of medical conditions since 9/11, breathing problems that are making this person feel that they can't do what they used to do in life. Chronic illness, as well as the natural aging process, will have significant impact on our emotional health. We spoke about illness related grief. And although today's case, I focus on anticipatory grief, illness related grief is very real. And we often grieve the loss of function, vitality of our roles and our activities in the context of that progressive illness. So please, I encourage you, reach out to us at 212-241-8462, and our social workers can provide next steps. And we also have another comment. Grieving is around losing parts of our identity. This is very true, like work or things that we can't do anymore. It is. It's a natural part of grieving and losing things that we were accustomed to. These functions that I spoke of, our vitality, our roles. The hope is that as we begin to integrate what that means in our lives, that we reconnect, as Mr. C did, with other important parts of our lives. And for Mr. C, it was around connecting with his children and his grandchild that he had not had the opportunity to connect with very often due to other things that we attend to in life. We have one other comment that says, in dealing with grief, I find it hard to share with those that I trust because I feel like I just repeat the same thing and sometimes the right words don't always come out right. And they all and this person also lost someone close to them 3 months ago. Again, I am so sorry for your loss. That is really, it's a really new loss and it's a very difficult loss. We've spoken today around the ways in which loss also shifts our identity in ways that we don't expect. And it is difficult. And grief is a difficult topic to sit with as a society. We should do better with this. But trust me when I say that there's no right thing, that whatever comes out when you're talking to your supports is what comes out. It's what you're feeling in that moment, and that it's not right, and that it's not wrong. It's right for you in that moment. I hope that's helpful. I want to thank all of you that shared personal aspects. Um, there is a lot of grief and loss naturally. Um, and I, again, hope that today's presentation offered us a little bit of self-compassion, most importantly, because sometimes that's a lot more difficult than giving it to others, but just compassion in general for grief and for loss and a different perspective on how we experience it and how others around us experience it as well. Thank you all for being here today.